Hi friends, welcome to this coffee chat. It's really just me talking, but still welcome. Get your coffee, tea, whatever you enjoy drinking and join me. So I've heard from a lot of people who say they feel very alone in what they're going through with Parkinson's disease. They've told me they feel isolated, embarrassed, and sometimes ashamed of their symptoms. I like to say that while we're unique, we're not that unique. So I wanted to do this video in hopes of helping others know that there are other people out there going through very much the same thing with this disease. So I'm going to be talking about my symptoms as a newly diagnosed young-ish onset Parkinson's patient, as well as some steps that I try to take to alleviate symptoms as much as possible. So I'm in sort of like, one genetic counselor said I'm in this gray area. So I feel like a middle child, you know. A lot of my friends that I've met in this community are older, they're retired. Some support groups that I don't quite fit into because they are very strict about being under 40. And I'm still working, and so I'm just kind of in this sort of realm where, you know, where do I fit in with things? So I'm trying to navigate that. So again, if there's anybody out there experiencing that, you're not alone. Because of my love for him and not wanting to be a burden on him later, I did tell my husband of 30 plus years that this could get ugly, and if he wanted to leave now, I totally understood. But before you gasp and wonder, how could you say something like that? I've talked to several people who've said the same thing to their significant other. So remember me saying earlier, we're all unique, but we're not that unique. But he insists on staying, and I tell him he's a glutton for punishment, having already served a 30-year sentence with me. So seriously though, if the shoes were on the other foot, I wouldn't leave him either. So I am grateful to have him with me on this journey. I'll also include stories that others have shared with me, although I'm not going to provide any identifying information in the interest of protecting everyone's privacy. But I'll take the opportunity now to thank those of you who felt comfortable sharing your symptoms with me, with the goal of helping others. So I really do appreciate it. This is a personal journey we're all on. Some are very open and willing to talk about what they're going through. Others are very quiet about their symptoms and diagnosis as a whole. I know a couple of people who have not shared their diagnosis with family or friends. So not disclosing your diagnosis is a very personal thing. So do what you feel is best. But the key takeaway that I want you to hold on to is that you are not alone in this. Some people with Parkinson's have told me it took years to be diagnosed, and it was a very long and frustrating process for them. Others have said that they were told they were too young to have Parkinson's. I've had a couple of genetic tests done as well, and I've been told that I'm not predisposed to Parkinson's disease, so it's not likely I'll pass this down to my children or grandchildren. 23andMe offers genetic testing with some DNA kits, and there are more options of genetic testing available, so I encourage you to speak with your primary care or your neurologist if you're interested in having one of those tests done. Before moving on, I want to stress that I am not a medical professional. I am not endorsing or recommending any products or medications that I'll mention in this video. I'm only sharing what I and others are going through, plus what we are finding helpful or not so helpful in our journeys. I encourage everyone to consult your doctor about anything you're experiencing or have questions or concerns about, whether you think it's related to Parkinson's or not. Dr. Google is great, but your doctor is your best resource. So with that, let's get to it. So here's a list of trade names or generic names as they were presented to me for the motor symptoms of Parkinson's. Dystonia, anxiety, sleep. Some people who wrote to me reported the side effects with some of them, like nausea. This list is only a reference. I have purposely left out dosages or other administering information because we're all different in how this disease affects us. So there isn't a one-size-fits-all approach. So please consult your doctor if you want to learn more about these or other medications to find out what may or may not be helpful for you. For my own experience, I take Azilect and Requip XL, which is an extended release pill. I'm on a low dose of the Requip XL because at the full strength it made me really nauseous and lightheaded. Occasionally I will take melatonin some nights to help me sleep. I also take a multivitamin, an additional vitamin C, vitamin D, and omega vitamin every day. I'm also listing Sustain, which I use for dry eyes, and I'll go into that a bit later. Other therapies that some said they've tried include electric muscle stimulation therapy and the LSVT Big and Loud program, which is the Lee Silverman Voice Treatment Program. The electric muscle stimulation gives mild electrical pulses that some find helpful for tremors. The LSVT Big and Loud program works to improve speech and body movement through exaggerated voice, volume, and limb movements, which I was told was successful for some, but not so much for others. I personally have no experience with these therapies yet, so I encourage you to do your own research and talk with your doctor if you want to know more. Some folks reported having an itchy scalp or dandruff since being diagnosed with Parkinson's. I had issues right after being diagnosed with scales that would develop on my scalp. I talked to my neurologist and my dermatologist about it, and both suggested a dandruff shampoo. It wasn't clear whether it was associated with Parkinson's itself or maybe the medications I was on. I had not needed a dandruff shampoo in the past, but I got Head and Shoulders and it helped a lot. Deep brain stimulation, DBS, is the procedure where electrodes are placed in areas of the brain to control movement. It sounds sort of like a pacemaker for the brain. Good and not so good results were shared with me. Some said it's controlled their motor symptoms significantly and has been a true game changer for them. It's helped with energy levels and has almost eliminated off times. They shared that they haven't needed a walker as much since surgery. However, others shared that they experienced infection from the surgery. Some stated the surgery did not help with their motor symptoms much at all. I've also been told that DBS hasn't helped with non-motor symptoms like constipation or sleep disorders. So if DBS is something you're considering, or you just want to know more about it, then please talk to your doctor. Depression, feeling unmotivated, and or moodiness were also symptoms some folks with Parkinson's shared with me. A few said they feel embarrassed by their symptoms and find they're more withdrawn now because they're very conscientious about their tremors and the physical symptoms. So this makes them feel very alone, unsociable. Some said they make no public appearances except to see a doctor as needed. Anxiety is also a problem for many. Others reported having hallucinations or seeing and hearing things. Some stated they have memory problems and confusion, or they have difficulty recalling words, and I experienced that myself. A counselor, therapist, psychologist may be helpful for these symptoms, and I'll have a list of doctors towards the end of the video that you might find helpful. One thing that I have tried to do to help with any potential cognitive issues is brain training type games. So there's one game I recently learned where you go through a deck of cards and you call out the number, the color, then the suit, and you just keep repeating as you go through the deck. So for instance, you would say king, red, diamonds. This can be a challenging exercise for anyone, but it's a good one for working on the noggin. There are a number of books at various stores that may also help keep the mind active, like Sudoku, crossword puzzles, and word finds. I see them at the grocery stores, retail stores when I'm standing at the checkout line. Online, you can find all sorts of fun and most importantly free apps like those I've listed here. Duolingo is a popular language learning app with various languages and fun activities you do while learning. So you might enjoy that, but here are several that I use. So I've had issues with dry eyes since my diagnosis. I brought this up to my doctor, but she didn't think it was related. I've since read, though, that we as people with Parkinson's tend to not blink as much, which causes dry, irritated eyes. My eyes feel dry and scratchy during the day, but at night it's really hard to open them if I wake up to use the restroom. It almost feels like the inside of my eyelids are stuck to the eye itself because they're so dry. At times the eyes get so irritated too that the lids get sore and swollen, and it's not pretty. But I've asked my ophthalmologist for suggestions in alleviating the dry eyes. She suggested Sustain for me, and it's been really helpful. I've tried re-wetting drops, but Sustain is more of a lubricant and coats my eyes better, so it provides me with greater relief. I also use a cotton ball with a small amount of witch hazel, and in the morning and at night I'll wipe the eyelids just to keep them clean as best I can. An optometrist or an ophthalmologist are great for helping with any eye issues you may be experiencing. Some people told me they aren't able to smell things like they used to. I've not had a good sense of smell for years, and since my Parkinson's diagnosis, I've learned that this is one of those interesting non-motor symptoms that can precede motor symptoms by years. I've watched a couple of webinars with different movement disorder specialists stating that the loss of smell, constipation, and the REM sleep behavior disorder can commonly precede motor symptoms, sometimes decades prior, and I've experienced all of them. Since my diagnosis, I notice I sometimes stutter or stammer more when I'm trying to speak. Others shared they're experiencing the same issues. Some said they know what they want to say, but it's just difficult getting the word out. I mentioned the stammering to my neurologist, but she didn't think it was related to Parkinson's. However, since learning about others with Parkinson's have experienced the same issues, I personally feel my changes of speech are related to the disease. I also tend to choke a bit on food. It'll go down sooner than I'm ready for it to, and then some people have shared that they have the same issue. I've read it's helpful to drink more between bites and to take smaller bites to more easily manage what's in the mouth. I personally tend to gobble my food because it tastes so good, so the smaller, more manageable bites is something I'm trying to work on. There are a couple people who told me they know they have the expressionless facial masking that's associated with Parkinson's. A speech therapist or speech language pathologist would be helpful for all of these issues. They can offer exercises for facial muscle rigidity, speech and swallowing troubles, as well as any drooling issues you might be having. A few people told me since being diagnosed that they've experienced shortness of breath, breathlessness, as well as heart palpitations, even if they're just sitting still. One person said she asked her doctor about it, but the doctor didn't think it was related to Parkinson's. However, she's heard from others who've had similar experiences. I think it's important to mention this to your doctors, neurologist and primary. Maybe ask if you can be referred to a pulmonary specialist, a cardiologist, or some other IST in that field. I'm not promoting someone being a hypochondriac, but if someone in my family complained about any breathing or heart issues that they were experiencing, I would want them evaluated. It may be nothing more than another side effect of Parkinson's to deal with, but it's better to be safe than sorry, in my opinion. So while no one who messaged me mentioned melanomas or any other skin conditions, I do want to encourage a visit to a dermatologist once a year for a skin check. As people with Parkinson's, we're more at risk of developing melanomas, which is a type of skin cancer, but if it's caught early, it's highly treatable. My dermatologist told me that melanomas can appear anywhere on the body, not just on areas exposed by the sun. So be mindful of any moles or other spots on your body and let a professional take a peek just to be on the safe side. Frequent urination is a complaint I receive from a lot of folks. I too find I need to be near a restroom, needing to take frequent breaks. When traveling, I used to really like having an aisle seat on a plane, but now I know I likely irritate my fellow travelers, climbing over them constantly, so now I take an aisle seat. And I'm always amazed at how folks can take a 5-hour flight and never get up once to go to the bathroom. Bathroom visits during the night can be tricky if you have balance issues. Some people suggested a bedside potty chair. Some use a walker. Others with more limited mobility use diapers. I heard from some men who have issues walking and standing, and they find that they need to sit to urinate, and this makes them feel emasculated. Constipation, as I mentioned earlier, is one of those non-motor symptoms that can precede motor symptoms, and it plagues many people with or without Parkinson's. A couple of people who reached out to me to participate in this video emphasized the importance of fiber, lots of water, and exercise. Metamucil was reported to me to help. I use Benefiber. I try to drink at least 80 ounces of water a day, and that's at least. Bran cereals were reported to help. I've become addicted to iced coffees lately. Nutty. But I've read that coffee can be beneficial for Parkinson's, so I'm going to go with that. I found that instant coffee made really strong. I'll put 2 and 3 heaping spoonfuls in the mug, and then I pour that over ice with sweet creamer. That helps on occasion when I need a little extra something. But exercise is probably by far the most important thing overall that we can do having Parkinson's disease, and physical activity can help with constipation issues by activating the digestive system and keeping things moving. Sleep problems seems to be a common issue for a lot of folks with Parkinson's. Several people told me they may only get 3 hours of sleep a night. I seem to go through phases where I don't sleep well, and then other times I just feel I don't get enough rest. I still work full time, as I mentioned before, and I find my weekends are usually very busy, so I don't feel there's enough time in my day to really take a good nap. But several folks strongly encourage them if you need one. As I mentioned earlier, there are several I heard from, myself included, that take melatonin. I find it very helpful. Others promoted cannabis and Xanax to help with relaxation and sleep. Some people stated they've experienced the REM sleep behavior disorder, which is the yelling, flailing, kicking, acting out the dreams. This can be disruptive to the sleep partner, not to mention dangerous. So one suggestion I received was sleeping in separate bedrooms as an option, leaving a Parkinson's patient, depending on the stage of Parkinson's, cognitive issues, etc., that might not allow for separate bedrooms. But something to consider might be separate beds in one room, or maybe two twins or two doubles pushed together with a bed rail or some kind of divider in between, just as a safety barrier. An occupational therapist may be someone to consult for suggestions and ideas. Balance issues and falling are very common issues many people with Parkinson's wrote me about. Freezing of gait was mentioned, and a few talked about random movements such as their foot stomping uncontrollably with no forward or backward movement. Walkers, again, were suggested to help get around. One person said he knows he needs a cane but refuses to use one. Other suggestions I received included removing rugs from floors, clearing more space where we walk, and maybe considering adding handrails to both sides of a staircase if you have to maneuver those in your home. Toe curling and dystonia, the painful muscle contractions, plague some people too. Several people said exercise helps with the dystonia. One person said Birkenstock shoes helped a lot with toe curling. Some also complained of unexplained, sometimes excruciating pain in the legs, arms, shoulders, and hands. So I like to think I had nice handwriting at one time, but I would notice that my hand would tighten as I would write, and my writing would get smaller and smaller and really illegible. So if I didn't type something out right away, I'd have no clue what I wrote. And I heard that from a lot of people, so I know I'm not alone in that. A friend suggested using my Alexa device more for keeping grocery lists and that sort of thing, and I found that to be really helpful. Other fine motor skills are challenging for some, like buttoning a shirt, tying shoelaces, or picking up small objects from the floor. I've noticed some challenges with getting my hand to cooperate while brushing my teeth. So I now have an electric toothbrush, which has been really helpful. And if I press too hard, the toothbrush doesn't cut off, but instead a red light will shine, and so it alerts me to kind of ease up some. Some other symptoms people wrote me about included profuse sweating, extreme fatigue, slowness with movement, and feeling weak a lot of the time. So these are all things we want to mention to our doctors. There may be medications that we can take to help alleviate symptoms. There may be changes we can make to our diet, start or modify exercise plans. There could be some other changes that could help with these symptoms, but talk to your doctor. Physical and occupational therapists may also play a key role in providing ways to improve mobility, flexibility, and offering modifications that we can make to daily routines. So, as most of you are already aware, studies have shown that exercise can help slow the progression of Parkinson's disease. So just about everyone who messaged me to share their experiences with Parkinson's stated they do some form of exercise most days, and it makes a huge difference for them. Some participate in spinning classes, swimming, walking, seated workouts. There's strength training, yoga, tai chi, dancing. There's all kinds of activity out there that people wrote to me that they participate in, and all can help alleviate aches and pains and stiffness that occurs with Parkinson's. Folks provided a lot of pros for exercising, such as a good feeling of movement, the mental peace and calm it can bring on, as well as any social interaction gained from participating in group activities. One activity I consistently hear great things about is rock steady boxing. I don't have a facility near me, but I participated in an online virtual class once, and it was a lot of fun. So you might want to check into that if you're interested. I enjoy walking and hiking. I also do yoga, tai chi, qigong, plus some cardio and strength training. So I try to mix it up a lot. But there are seated workouts, standing workouts, something for everyone out there. And you can find classes at your local rec center as well as online. I have a variety of exercise videos on my channel, and there are a lot of other great YouTube channels I follow for fun and challenging workouts. So, search around and find something you like. The important thing is to just keep moving. As I mentioned earlier, some people who experience dystonia told me that exercise and stretching lessens the severity of the muscle contractions. Also, exercising in front of a mirror can be helpful. For example, I've noticed looking at my reflection that my right arm doesn't have quite the same range as the left anymore. So I try to focus on that more when I work out and really reach the fingertips and extend the arm more on the right side. I recently sat in on a webinar where one doctor suggested that all patients should be prescribed exercise like they are medications because it's such an important part in staying healthy with this disease. So I want to challenge you all to try that. Every time you take your medicine, do some sort of physical activity, whether it's walking around your kitchen, down your street, do some seated punches, kicks, big arm circles, march in place, standing or seated, anything. Just get the body moving and the heart pumping. You can do it. Build your care team. If you have Parkinson's or you're on course for a diagnosis, you're likely seeing a neurologist already. Many people promote getting a movement disorder specialist as well. Plus, there are other helpful professionals I've mentioned earlier who can offer treatments and therapies for symptoms as this disease progresses for us. Even if you feel you don't need a physical therapist yet, as an example, consider talking with your current neurologist or movement disorder specialist to find one you can visit, at least to set up a baseline. Also, if there's anything you have questions about but you feel nervous or embarrassed to ask, email your doctor ahead of time or write down your questions to hand him or her at your appointment to help get the conversation started. They don't know something's wrong if we don't tell them. I feel confident in saying that there is likely nothing you can ask that they haven't already heard before. Again, we're all unique, but we're not that unique. There were a couple of people that admitted to still having a hard time accepting their diagnosis, and they're confused about where to go from here. I encourage everyone to find a support group near you if you haven't already. They may offer in-person group meetings or virtual ones, some women or men only, some co-ed. There are several Parkinson's organizations, foundations online that offer support, and you can visit my About section on my channel to find links to several to get you started. Finally, I want to mention complementary therapies, like some of these I've listed here. They're simply extras we can do along with our medical regimen, sort of like taking a well-rounded mind-body approach to living well with Parkinson's. A number of people said they found complementary therapies extremely helpful for keeping a positive outlook, improving balance and flexibility, and just staying healthy overall. I've not tried acupuncture yet, but I am interested in it as I've heard positive things from people who've had it done, like feeling more relaxed, less stress, less muscle tightness. I mentioned earlier that I do yoga, tai chi, and qigong sometimes, all from various YouTubers. These exercises are great for helping me relax, stretch, and I think they help my balance and flexibility. Others stated yoga has been really helpful in improving their balance. Meditation is another great way to relax. With mindful meditation, you're present in the moment as you try to rest and refresh your mind and body, even if it's just for a minute. A couple people expressed joy with art and others with dancing. One person said she especially enjoys tap dancing. She purchased a tap board to have that neat sound of the shoes hitting the floor in her house. But she realized quickly the sound of one foot was different from the other. So this actually helped her identify the need to focus on one leg more to improve mobility. Something interesting I recently heard is, I believe it was a research study showing a possible link between dopamine replacement medication and an increase in creativity. So you may find painting, writing, some other artistic activity to be just the right thing. Or you may find, like me, you suddenly buy more arts and craft projects to work on than you have time for. but find something you like and enjoy. Again, I am not promoting or endorsing any product or medication mentioned in this video. I just wanted to share what I and others are going through and what we're doing to stay healthy and positive with Parkinson's disease. So I hope this has been helpful to others in knowing they're not alone. Knowledge is power. We're an estimated 10 million strong worldwide, and we are in this together. Thank you again to all of you who participated by sharing your experiences, and thank you for watching.